Hi, today's blog is about my beautiful patient, Dexta. She's featured heavily on my Snapchat story over the past 6 months, and that's why I am going to use Snapchat filters to help tell her story.
Dexta is only 5 years old and she has been diagnosed with cutaneous haemangiosarcomas and squamous cell carcinomas.
And despite all that, she is one of the happiest patients coming into the clinic. I absolutely love seeing Dexta. She is such a happy girl.
Good morning, Snapchat. This is Dexta. Dexta is here to have, what are you here for? A skin biopsy today. She's so cute. Look at her. So Dexta presented to me as a second opinion. She'd already been treated for a skin infection and it wasn't getting any better. I gave a higher dose and a longer course of antibiotics and there was still no improvement. So this is Dexta's skin after 2 weeks on high dose antibiotics. It's made no real difference. I suspected this area was like a deep pyoderma, but it hasn't really responded. Okay, so I've taken a bunch of biopsies. Dexta's just waking up now. You can see there's a few lots of stitches here. So I should get the results in about a week and then we'll know what to do. Howdy Snapchat, this is Dexta who came in just over a week ago for some skin biopsies. I got the results back and she's got a squamous cell carcinoma. She also has haemangiosarcoma in the skin as well as some unknown or yet to be identified infection. So she's here for some staging. So we're just about to do chest x-rays and then I've got a specialist coming in to do an abdo ultrasound. She's like, no photos, damn it woman. No photos, hello. Okay, so this is her skin after my biopsies that I've done. So down here where I'm pointing is where there's another squamous cell carcinoma. This here is an haemangiosarc. I removed the other haemangiosarcoma there, so I've got to take that one off. But we're just going to check that when we stage her that there's no more cancer. Dexta is sedated in this picture and we're using sandbags to hold her in position for her chest x-rays and she was really good and she just laid there. Check this out. She is such a tart. She's like, just play with me. You see her tail going in the background? Oh my god, she's so cute. And this gorgeous girl is Dexta, she's featured a few times on my Snapchat. She's here to have her squamous cell carcinoma removed and her haemangiosarcs removed. Okay, so we haven't cleaned her belly yet, but you can see that I have removed Dexta's squamous cell carcinoma. I had to take 2 centimetre margins and I had to take a deep margin of a muscle layer as well. So that's why it's kind of tucked in a bit here, but it's come together nicely. After the squamous cell carcinoma surgery, I referred Dexta to a dermatologist because the deep pyoderma was still not improving, and the dermatologist referred her to an oncologist, and the oncologist suspected that there may be an underlying squamous cell carcinoma in those areas of deep pyoderma that weren't responding to medical treatment. So she recommended that we surgically excise those areas, but given their size, I needed to get an experienced surgeon to come in who could perform skin flaps. And that's what you're seeing here in these pictures is the skin flap being performed as well as then the recovery over the coming weeks. Good morning, this is Dexta. Oh, hello Dexta. Dexta is here to have a suspected cutaneous haemangiosarcoma. So she's having a cutaneous haemangiosarcoma removed. She has previously had squamous cell carcinomas removed as well as had 2 big skin flaps. Oh, good job. So roll over again. Dexta, roll over, show everyone. So this is her tummy. This over here, the purple spot. So yeah, she's coming in to have that little purple tumour removed. She's had others of those already taken off. So basically we remove any little skin cancers that come up with her. A lot of it is related to previous sun damage. She now wears t-shirts and pretty much completely lives inside and doesn't see the sun at all and has her own little bodysuits. But unfortunately the damage has already been done, so we have to keep removing these tumours. Alrighty, I got Dexta up on the table and she's got her IV catheter in and I'm about to anaesthetise her with alfaxan and then we're going to do surgery. Okay, so Dexta's asleep under the anaesthetic and I have Nurse Emily clipping the area and then she's going to clean it for me as well and then we'll transfer it into surgery. Right, so she's in the cradle and we've clipped the hair away And this is the lump if it'll focus for you. There we go, there's the lump. So you might notice over here, so she's had a skin flap where we've had skin from here twisted around, removed and stitched down on here, which means that these are nipples on her leg. So she's had a slightly abnormal boob job. And the lump has been removed. So we're going to send it off for histopath to find out if I've got clear margins and to know for sure what it is. Okay, she's waking up now and I just checked her ears. Can you see all the discharge in her ears? So I'm going to do a swab, have a look under the microscope. Ew, this is the ear infection. Oh, it's not focusing on it, but anyway, I don't have enough hands to make it focus. This is the cytology from her ear infection. So these are little yeast that you're looking at. My vet student made them into a dog, which I think is quite cute.
So that is darling Dexter's story. I hope you've enjoyed it. She is a super brave pup who's been through a lot, but she's still doing really well.